Good afternoon, everyone. Thank you for joining us. My name is Marissa Waterman. I'm the Marketing Director here at American Academy of Environmental Engineers and Scientists. First off, we want to thank one of our partners, ABET, for sponsoring this webinar. Today, we have a full house. Here with us, we have Dr. Naughton, Assistant Professor at the University of California Merced, along with 4 students who will be presenting today. Before we get started, I just want to mention that you'll be able to message your questions at the end of the presentation. Once the presentation's over, you'll be able to type your question into the attendee chat on the left-hand side of your screen. We'll also share their email addresses, so you'll be able to email them directly with any questions you may have. Okay, let's get started. Dr. Naughton will be introducing the student presenters. Good morning. We're ready when you are.
Good morning, everyone. Thank you so much for this opportunity for AAWES and having us and taking this chance on having student presenters and a full panel. We really appreciate it and all your work. I have a dream or goal to be board certified one day and really appreciate all your efforts. And so today we'll be presenting on students converging COVID-19. I'll try not to take up too much of the time and let the students speak. So just background on our lab and like how we got involved in COVID-19 research. Our lab strives for food, energy, water systems for the underserved and all of us in the United States and globally. So we try to co-design sustainable and culturally sensitive food, energy, water systems with communities. And COVID-19 really impacted all areas of food, energy, and water. And so we tried to pivot to help the community during this time. A little bit about me, if you didn't see my bio, is I'm an assistant professor in civil and environmental engineering at the University of California Merced. I went to Purdue University for undergrad, so go Boilers if there's any Big Ten people there. And I went to University of South Florida for my doctoral research, where I did the Peace Corps Masters International Program, and I served in Mali, West Africa as a water and sanitation engineer. So I've been passionate about wastewater for a while, so you'll hear a bit about our wastewater research. And I also did a science and technology policy fellowship in Washington, D.C. with the Millennium Challenge Corporation through the American Association for the Advancement of Science. So our presentation today is that, as Marissa mentioned, we have a full house featuring student speakers. We'll talk about the Converging COVID-19 series that was funded by the National Science Foundation, and we did that last fall. And then we had a Youth Moving Forward session of the Converging COVID series in spring 2021. And then we'll feature some case studies and student research first on COVID-19 impacts on the food supply system, and then wastewater and COVID-19, our global dashboard COVID Poops 19 of wastewater monitoring locations of SARS-CoV-2. And then the data center, that's a larger collaboration led by Dr. Joan Rose at Michigan State University, so WSphere, some conclusions, acknowledgements, and time for question and answer. So these are our student presenters today. I can't be more proud of all these students and what they've accomplished over this past year and a half and even 2 years for some of them that have been in the research group. And they really, overcame a lot of challenges in the pandemic, everything shifting to online learning. I don't know how I would have done senior year in undergrad, all virtually. So Fernando and Ariana recently graduated with their bachelor's in environmental engineering from UC Merced. Fernando's at Virginia Tech now, doing research with Dr. Mark Edwards. And Ariana will be joining University of Arizona for graduate school, working in the Navajo Nation. Ana Grace Alvarado is now a second-year PhD student, so she moved from Minnesota to California during a pandemic and during wildfire season, and it was wildfire plus pandemic, and had to have all of her first-year classes in grad school virtually, but also doing COVID-19 research in both food and wastewater. Brooklyn James has been amazing, helping to organize the Converging COVID-19 series and Youth Moving Forward session I'll introduce her a little bit more before she speaks. But really, these students, were experiencing a lot during the pandemic, as all of us have, and then really uh, stepped up and just also conducted COVID-19 research, like spending many hours, late nights on webinars and analyzing data. So I'll start with like a brief overview of the report of the Converging COVID-19 series. And so this was funded by the National Science Foundation, a conference grant, and it was also supported by AWSP. So I know there's a lot of members between AAWS and AWSP, the Association of Environmental Engineering and Science Professors. And the principal investigator on this grant was Dr. Maya Trotz. So we'll go over some of the goals and motivation, logistics of both of these sessions, and then some results and discussion. And so if you want to put in the chat, if you were able to attend this series, that'd be great to know, our audience. And then it's not too late if you still wanted to see some sessions, they're all on YouTube. But I want to first, I know we have student presenters that were all part of the series, but there's also ones from University of South Florida, that student organizers, and Estelle Houghton and Ashley Osler, and Heather Hopkins is a program coordinator and research support specialist that was really like the driver behind all the logistics with the Zoom webinar that we did for the conference. So I want to thank them, and I want to thank all of you if you participated, and also Dr. Abram and Dr. Orther were presented at the Converging COVID series. Dr. Abram was a great moderator and reached out for us to present here, and Dr. Orther was one of the presenters as well on our series. So goals and motivation for the AWSP Converging COVID-19 Environment, Health, and Equity session was just me and Dr. Trotz were on Twitter seeing all of the research that our community was doing, environmental engineering and scientists, to help with the pandemic in all these different sectors that you see here: wastewater, food, water, definitely air, since COVID-19 is airborne, waste with the medical waste, and also just the municipal solid waste that was generated and changed during the pandemic, built environment, and still experiencing impacts of climate change and sort of the inequities happening during the pandemic. And of course, unfortunately, in the summer of 2022 with the murder of George Floyd, and then sort of the realization of like the greater racial disparities that have existed for a long time and are perpetuated in the pandemic. So we really wanted to, Dr. Trotz and I really wanted to amplify the voices in our community through this conference series to help educate the broader public about what all of us were doing in this space, and kind of bring everyone together. We're still kind of in some of our subdisciplinary silos. So convergence is about integrating knowledge, methods, and expertise from different disciplines and forming novel frameworks to catalyze scientific discovery and innovation. We're also known as the deep integration across disciplines. So many of us are working with public health officials, or even like in doctors. And so really we need this kind of convergence to help address wicked problems or complex problems like COVID-19, like climate change, like others. And so logistics of the conference, we had six sessions over 6 weeks. They were an hour and a half each, but we had 5 panelists in each one that presented for only 5 minutes, and we tried to keep it, simple for the general public. The slides a little, more with graphics and fewer text, and less like academic and scientific jargon, since we did have high school students and broader public attend, parents of the presenters or students. And each of the sessions followed the theme of the environmental engineering grand challenges. So for sessions 2 through 6, and session 1 focused on engineering education, which was like kind of the ultimate grand challenge. So I still have the environmental engineering grand challenges book. But we also wanted to focus the series and that session on systemic biases from what we saw happening during the pandemic. and of course in the summer of 2020, and had that as a theme throughout the conference, as well as convergence. And then we had faculty moderators for each session. So logistics, we used Zoom Webinar, which is not the most intuitive platform, lots of checkboxes and like logistics of like going live and then, using video, like turning off and on video and mute and slides. So there was we have like a full sheet there that we'll share in the publication, hopefully, about doing sort of these larger online conferences that everybody's gotten acquainted with. We tried to make it more accessible with closed captioning and sign language interpretation and instructions, since we had general public, not just academics, attend. And then we had a quiz for each session. So each of the faculty presenters or academic presenters submitted a true or false question or a multiple choice question. And then we had a quiz. And if you got 80% or higher on all 6 sessions, you would get a certificate. And you could use that for Envision credits. And then questions, we tried to have more than one option. We had Zoom, the traditional Zoom Q&A, but also through Gmail and through Twitter. Excuse me. And then for each panelist, we had them, we asked them 2 questions, one related to equity and one to convergence, of like, what role does equity play in your research and teaching? And how can you incorporate equity in your research and teaching? And then related to the theme of convergence and others on this panel, how can we make our research more convergent? And so results from the session, it feels like it was a decade ago or even yesterday. The time sort of operates differently now. It's hard to believe we're presenting on the results of this series last fall. And so we had attendees from all over the world, mostly, of course, North America, Canada, and the US, and some in South America, but we did have some from Europe and Africa and the Caribbean. And we had over 100 attendees each session, not too much of a drop off throughout the series. And then we had 43 people earn their certificates. We had a lot of people take the quizzes. And thanks to the professors that kind of integrated it as extra credit in their class to take the quizzes. And results, as I said, you can still listen on YouTube for these sessions. And even if you don't want the full hour and a half with the Q&A and the panel and speeding through, Ms. Del Houghton, one of the student organizers, made 5-minute videos of the different presenters, so you can watch just the 5 minutes. And so we've gotten over 100 views each on each of those sessions as well, and at least some likes and no dislikes. And so for the submitted questions, most of them came during Q&A, the Zoom Q&A, but we did have some through the Gmail option and the Twitter. We had some that were submitted through Twitter. And so hopefully, in the future, just, social media as a whole, field and creating engagement and whatnot through that takes a lot of time and effort. So we're still trying to foster that in our community. But with that, those are the results of the questions. But I'd like Brooklyn, she did an analysis of each of the equity and convergence questions that were asked to the panelists. So she did some qualitative research where she used the transcripts and then looked at different themes. So as I said, Brooklyn James is she's a 4th year. She's going to graduate in December, and right now she's doing research with Lawrence Livermore Laboratory for carbon cleanup, their carbon cleanup initiative. So I'll take it away, Brooklyn.
Thank you for that introduction. So as Dr. Naughton mentioned, during the Q&A portion of the webinar, the speakers were asked 2 questions in order to specifically address the key concepts of the series, which were equity and convergence. So at the end of the conference series, the team wanted to analyze the responses to these questions and determine if there were any repeating themes that arose in the conversation. So when asked related to the theme of convergence and others on this panel, after hearing their presentations, how can we make our research more convergent? Many recognize the need for community involvement, addressing problems not only interdisciplinarily, but also with the inclusion of the groups of people whom the problem directly affects. This question also drew speakers to the conclusion that the pandemic has caused an increase in awareness of convergence research, but there's still a long way to go. So next we asked, what role does equity play in your research and teaching? And many of the speakers discussed the need to address a variety of cultural perspectives in one's teaching, as well as having humility and a deeper compassion for all cultures. And that making connections with students, emphasizing listening, empathy, and understanding in classroom procedures and research tactics is needed to create an integrated workspace. Our final recommendations are to create more subdisciplinary discussions and collaborations, as well as interdisciplinary opportunities, such as the Predictive Intelligence for Pandemic Prevention Phase 1 Development Grant. There is also the need to broaden our participation in events and call out underrepresentation when we see it. And finally, when debriefing about the extent to which we were able to address equity during the conference, the team realized the lack of youth representation within the panels and youth-based content within the presentation themselves. And so this led us to the creation of Converging COVID-19 Youth Moving Forward, a follow-up session to the main conference series. In April of this year, we hosted this platform for the younger generation to have the opportunity to discuss the pandemic from their point of view. We invited professors from both public health and environmental engineering backgrounds to provide their expertise and to answer questions and participate in discussion in 4 separate breakout rooms, which were youth health, vaccine, environment, and education. Addressing the lack of youth and student representation was the main goal of the Youth Moving Forward conference. It was key for us student organizers to reach out to clubs and organizations within our own campuses, as well as in other graduate schools, high schools, and even junior highs. We branched out through social media, which is a common media type among youth, to try to bring awareness of convergence research and equity as they pertain to COVID-19 and the 4 different topics. The conference structure consisted of a presentation portion where each professor gave a 5-minute talk on their specified topic, following with a 30-minute discussion session in Zoom breakout rooms, and concluding with a summary of important items that were discussed in each room. And in order to encourage discussion on each of the topics, the student organizers prepared questions to prompt conversation, and we used Google's Jamboard to provide a visual representation of each of the conversations. So I wanted to highlight some of the specific ideas that were mentioned in each of the breakout rooms, and I'm going to start with youth health. And some of those key discussions that emerged from this were that many youth were experiencing an increase in fatigue, shorter attention spans because of online classes, lack of sociality, and changing mental health because of the effects of the pandemic. They also mentioned the lack of youth-focused information regarding COVID-19, and that moving forward, there needs to be more engagement of youth, for example, in social media. So in the vaccine breakout room, participants discussed the importance of addressing the misinformation about the COVID-19 vaccine in order to lower vaccine hesitancy. Others pointed out the inequities in vaccine distributions, where the US had a surplus of vaccines while other countries were in shortage. The environment breakout room touched on the increase in waste during the pandemic, the best ways to protect yourself going forward, and that the pandemic has brought to light the severity of climate change and will hopefully start encouraging serious action. Lastly, in the education breakout room, there was a focus on the impacts that COVID-19 has had on student resources and the way that teachers and professors are managing their classrooms differently. Youth addressed the inequities that are taking place within the education system because of the pandemic and the potential accommodations that would be beneficial to students when we return to in-person learning. To go over some of the logistics, we had a total of 84 registrants in which 44 attended the main presentation portion of the conference. As far as breakout rooms, we had 11 in the youth health, 4 in vaccine, 6 in environment, and 8 in education. The overall conference really allowed students to ask questions and receive direct answers from professors in public health and environmental engineering while being included in the discussion around the pandemic moving forward. In the future, this opportunity would have been more effective with a wider outreach in order to achieve greater audience participation. We'd like to increase the number of people who attended. And specifically, we would like to have more international participation to reinforce the inclusive perspectives. However, we did learn that the inclusion of youth perspectives diversifies that conversation. So our next speaker will be Anna Grace. She's an environmental systems graduate student at UC Merced, and she is going to present her research on the impact of the COVID-19 pandemic on food systems.
Great, thank you very much, Brooklyn. Okay, so with that being said, I'm going to jump right into it, but I hope to not bring back any or too many negative memories thinking back to the beginning of the pandemic. But if we really think back to the first pandemic-induced shocks, we're thinking in the supply chain, we're thinking of the effects of hoarding and stockpiling. If we remember going to the grocery store and seeing empty shelves, this increased buying pattern for personal stockpiling really was mimicking this increasing in demand. However, because we wouldn't constantly go back to reproduce that demand, it induced this phantom demand. So stores were unable to predict future demand for products and then struggled to make informed decisions. On the other hand, as we were go to the grocery store and see empty shelves, maybe on the news you were similarly seeing dumping of dairy products, large pits being filled with marketable goods, or the plowing over or tilling under of fruit, vegetables, tubers, etc., all sorts of crops. And prior to the COVID-19 crisis, a profitable harvest season was considered when half of the crops were sold. And so with this unfortunate surplus, we were seeing an even greater portion of crops that were going unpicked, unsold, and even uneaten. But farmers were put in a difficult situation, as planning is a crucial part of agriculture to make sure that you're not overproducing nor are you underproducing any sort of goods. And so the abrupt termination of contracts for farmers, whether it be because of border closures, travel restrictions, stay-at-home orders, transportation or exportation restrictions, etc., we saw this large amount of food surplus. A way to hopefully alleviate or address some of these issues, we saw the USDA food box program, which had the USDA purchasing US-grown produce, meat, and dairy products that would then go to food boxes for those to then be distributed nationwide for anyone that needed that sort of aid. Additionally, having the Paycheck Protection Program was a loan that helped businesses keep their workforce employed during the COVID-19 crisis. Additionally, shutting down of federally inspected meat processing plants caused farmers to euthanize their animals, creating this backlog or this bottleneck effect. Livestock farmers lost a lot of profit having to hold on to their slaughter-ready animals, since feed is one of the livestock farmers' top cost, and animals like chickens and pigs, not children, spent their times in temperature-controlled barns, which cost farmers to lose profit. Unfortunately, if livestock farmers could hold on to their slaughter-ready animals, they were then forced to euthanize them themselves. And this not only leads to an incredible financial loss, but it also came with an emotional toll. Livestock farmers previously would send their slaughter-ready animals to plants, where they would be slaughtered in a more peaceful manner. However, farmers were then forced to kill the livestock that they had raised, and they didn't have the resources to make sure that the animals could be comfortable during this process. This was such a large issue that the National Farm Aid Hotline was set in place for farmers to cope with any financial losses and difficulties of really being a farmer. But as of May in 2020, they even set up a suicide hotline to help farmers with any emotional tolls additionally caused by the pandemic. Alongside seeing, again, empty grocery stores and the dumping of food, we also saw an increase in unemployment, which led to a similar increase or drastic increase in food insecurity, both in the United States and globally. But the increasing of goods in grocery stores also played a role in this difficult situation, much that the national basket of supermarket goods had increased by 2.8% in the beginning months of the pandemic. Additionally, then at the beginning of the pandemic, we were seeing 43 million people, or more than 1 in 8 people in the United States receiving food stamps. And summer enrollment of SNAPs was 13.4%, which was close to 15% of the US experienced during the Great Recession. Additionally, if you can see in this upper right-hand image, or images that we additionally saw in the news, these images of lines wrapping around corners outside food banks. If you saw maybe aerial shots of parking lots with all these cars snaking around in parking lots, it shows unfortunately similar images to images that I saw in my textbook when we were learning about the Great Depression. And so with poverty on full display, it causes an additional shame for those that really needed help. And so at the bottom right corner, you can additionally see a graph that looks at children that were food insecure. And we can see this drastic increase in June in 2020 during the pandemic. And so taking into account food insecurity, the empty grocery store shelves, and this excess in food surplus, as stated by former Obama administration Agriculture Secretary Tom Vilsack, it was really not a lack of food, but instead of lack of connections within the food chain. So hopefully, but then additionally, then thinking of the many COVID-19 cases that stemmed from meat processing plants due to the conditions at the plants and the facilities used by some of the workers. Meat processing plants like Tyson were praised for testing workers, but the 3 largest meat packers were unfortunately responsible for 40% of these sectors' COVID-19 cases. And so interviews with meat processing plant workers indicated that employees were worried to go to work and fears of contracting the virus. And so one worker even shared, this is a quote, "A coworker showed up to work and she was coughing. She told us she was threatened with her job if she didn't show up," end quote. They additionally added that many of their colleagues were told to keep working despite having fevers, coughing, or even throwing up. And despite the various news articles that were documenting meat plant workers expressing their unsafe conditions that they were experiencing, the first COVID-19 related citation for meat packers didn't happen until September of 2020. People of color were or are disproportionately affected by COVID-19, and for many reasons, but this can easily be seen in meat processing plants, since according to the Center for Economic and Policy Research, Black, Latino, and Asian workers make up approximately 70% of the processing line workers in meatpacking plants, but only 29% of the U.S. workforce. And lastly, then undocumented workers similarly lack insurance, not similarly, but additionally lack insurance, and are fearful that seeking treatment could additionally lead to deportation. And so now to hopefully kind of shift to a more positive light is a way that we tried to move forward was the Prime Act was enacted, and it was an exception act that allowed small farmers and ranchers to slaughter and process their livestock at local facilities rather than hauling their livestock hours away to industrial meatpacking plants like the one seen in this image. And so with that being said, hopefully thinking in a more positive light and moving forward, how can we create a more resilient supply chain. A shift to a more localized system with a more circular economic framework would be beneficial for our global, national, and local food systems, really. The implementation of this circular economic framework prioritizes goods with a long life and shortens production feedback loops by advocating things like recycling, refurbishing, remanufacturing, etc. Facilitating a circular economy within the food system will, in essence, really reduce our overall waste generation by creating a circle of production and consumption. And then lastly, this circular economic protocol also focuses on preserving the natural environment, which is an integrated approach that's greatly needed from a shift from our industrialized agriculture. And so this is very much so a potential solution. But in this slide, I also present hopefully some more individualized potential solutions. COVID-19 has caused many regional, national, and global issues, right? Also, personally, we've all been affected by it. The silver lining of the situation at hand is that we've had the time and we've been exposed to some of our systems and some of the flaws in them. And so we have a great opportunity now to facilitate resiliency in various systems. The flaws in our food system are really unfortunate, but again, it's become more apparent to us as consumers, so it's a great opportunity to us to move forward in a positive light. This allows us as consumers to also invest and reevaluate our priorities and make individual and systemic changes. And so one of the first things that we can do, and I ask you to do this with your next meal, is hopefully really appreciate everything that you are consuming and all those people that got it to where it is now. One of the first, it's then additionally necessary for us to create systemic changes in our food system to make sure that it is more resilient if or when another pandemic arises, any climate crisis-induced disruptions, etc. But these more larger or systemic issues can, again, be more a shift to a short localized supply chain with a circular economy, even things like diversifying crops, chains, outlets, and etc. But the lastly, just being a aware and an appreciative consumer. And we all play a role in our national and global food systems. And so it's important that we support and appreciate those that get us the food that we need. With that being said, some of the first steps that we've done to hopefully try and make some systemic changes, UC Merced has a Building the Future docuseries, and Dr. Naughton and I, and then another student in our lab was interviewed for this docuseries. It's really, it's a cool docuseries because they also interview someone from the food bank, they interview farmers and ranchers, so it's a great opportunity to learn from other perspectives and hear about everyone's views. Similarly, another student in our lab who is actually on the call created the community food map of Merced. This food map has a lot of locations on it. You can find free food for school children, for UC Merced students, farm stands, farmers markets, community markets, and even the Merced Food Bank. I recommend that you check it out, and if you can find something similar to where you live, that'd be great. With that being said, I'll pass it on to Fernando. We're trying to find a fun way to transition, and so with everything that comes in, it must go out. And what we might consider as waste, Fernando will share how it can be used as a tool.
Thank you so much for the introduction, Anna Grace. One thing I learned to really appreciate throughout the COVID-19 pandemic, and especially throughout Anna Grace's presentation, is to greater appreciate food availability. Another thing that I really learned to appreciate throughout the COVID-19 pandemic is the usefulness of wastewater. So for my section, I'd like to talk about the practice known as wastewater-based epidemiology. Wastewater-based epidemiology, which is also known as wastewater monitoring, sewage surveillance, or WBE for short, is a practice of looking at a biomarker in a community's wastewater, quantifying the biomarker or chemical in the pooled sample, and taking multiple samples over a period of time to see how the concentration of the targeted biomarker changes over time. While wastewater-based epidemiology has definitely surged in popularity due to the COVID pandemic, it's not necessarily a new practice and has historically been used to monitor illicit drug use along with other pathogens such as poliovirus. But with the advent of COVID-19, scientists and health officials all around the world have been utilizing sewage surveillance to monitor levels of SARS-CoV-2 within different municipalities. Up to over 50% of people infected with COVID-19, both symptomatic and asymptomatic, shed SARS-CoV-2 RNA in their feces. It's because of this that scientists and engineers can sample the wastewater in a community targeting SARS-CoV-2 RNA and eventually show trends of SARS-CoV-2 levels within a population. Since infected individuals shed the virus as an early symptom, groups analyzing wastewater can help predict outbreaks of SARS-CoV-2 2 to 14 days prior to them actually happening, allowing for local authorities to help stop the spread of the virus. This has also been done all around the world on multiple different scales, as many different universities and public authorities around the world have started using sewage surveillance to guide local policies on COVID protective measures. Due to our immense love of wastewater and appreciation for global collaboration, our team at UC Merced decided to create and share a dashboard which visually summarizes global SARS-CoV-2 wastewater monitoring efforts. Inspired by the innovative and intuitive dashboard, such as known as the Johns Hopkins University COVID-19 map, we created a dashboard anyone can access to see universities, countries, and sites where wastewater-based epidemiology is being used to check levels of COVID-19. The dashboard we created is also interactable, as you're able to zoom into the map to see the data on a more granular scale. And we added links to news articles, dashboards with wastewater data, and publications for many of our points for anyone interested in learning more about wastewater testing in a specific area. We also have the legendary Twitter page at COVID-19, where we have interacted with many people interested in wastewater in many different languages, ranging from scientists and academics who test wastewater in communities, water enthusiasts, and the general public alike. Overall, we've been able to inform many different people on the usefulness of using wastewater as a public health tool. Of course, since many places have just started to implement sewage surveillance, our team has worked hard to continuously track all the new places testing their wastewater. As a team, we constantly monitor wastewater-related slacks, attend webinars, scavenge the internet, read through news sources, study publications, conduct keyword searches on Twitter, conduct keyword searches on search engines, connect with wastewater monitoring practitioners, and go through user-submitted requests to keep our dashboard up to date. We have also made efforts to look for SARS-CoV-2 wastewater-based epidemiology articles in different languages, since we want our dashboard to be inclusive and to include all wastewater monitoring efforts made around the world. From the data collected from our dashboard, we were able to see the countries using sewage surveillance for the global pandemic and discover that there are currently no countries with low income levels that have been able to implement SARS-CoV-2 wastewater-based epidemiology. Even in the United States, which we found to be the country with the most sites that test wastewater, does not have wastewater monitoring efforts equally distributed through every state and territory. Going further, some states like California, which overall has quite a few wastewater treatment plants that are testing the wastewater for the virus, does not have equally distributed wastewater monitoring efforts from county to county, as you can see here. These disparities are both concerning and problematic, since many of these areas which may lack adequate water, sanitation, and hygiene resources could greatly benefit from monitoring their sewage. It could also mean that areas that are decentralized, rural, or that implement non-traditional wastewater systems can have a harder time using wastewater-based epidemiology, as lots of the advancements in the field and practice have been geared towards traditional sewage systems. Moving forward, we hope to see more wastewater monitoring innovation being directed towards decentralized areas, so that this technology can serve as a tool for helping communities limit and control the spread of COVID anywhere. Another aspect of our research has been looking through all the dashboards which report wastewater data. Out of the 8 dashboards we currently feature on our dashboard, only a small subset of them actually have downloadable data. And of that downloadable data, the formatting of it and the data that's downloadable varies widely from dashboard to dashboard. As someone who's personally spent a lot of their senior year in undergrad looking at these dashboards, I recommend that future dashboards may want to include videos explaining the organization's monitoring efforts, a tutorial with how to explore and understand the dashboard, non-technical and non-esoteric language, and ideally downloadable data so anyone can use the dashboard as a valuable resource for many different applications. One great example of a SARS-CoV-2 wastewater monitoring dashboard is the Ohio dashboard, which is very intuitive and has downloadable data for each wastewater facility monitored. The dashboard, which gives a great explanation of the meaning of the data, also shows how to interpret the results presented and demonstrates the collaborative effort needed to conduct and utilize wastewater-based epidemiology effectively. Another great example of SARS-CoV-2 wastewater monitoring through a dashboard And one of my personal favorites is the wastewater dashboard for Scotland. The dashboard is highly accessible and open to the public. It's easy to download. It has information regarding sites sampled, estimated population served by each site, sampling results, measured N1 values, dates, day since sampled, and the health area each site belongs to. Their methods of sampling and lab analysis are also featured on the dashboard, and it has a very nice, informative visual aspect with arrows for each site showing trends related to how the concentration of virus RNA is changing over time at different sample locations. By good fortune, the knowledge we gained while looking through wastewater dashboards was applicable to the next project we helped work on, which will now be covered in the next section by Ariana Quintariki. Ariana, who recently graduated with a Bachelor's in Environmental Engineering from UC Merced, and who will be attending the University of Arizona next semester to work with the Navajo Nation, will now talk about the W-Sphere project.
Thank you, Fernando, for such an amazing introduction. So still going off of the topic of wastewater testing, I have the pleasure of presenting on the work our group did with some passionate members in the fields of wastewater to develop a global data center to map and display wastewater monitoring efforts happening around the globe. This data center is named Wastewater Sphere, which stands for Wastewater SARS Public Health Environmental Response, or W-Sphere for short. Going off of what Fernando presented on, W-Sphere is a congregation of data from available dashboards around the world. The visualizations and trends of SARS-CoV-2 concentrations from wastewater monitoring will inform researchers, labs, health authorities, or anyone from the public who may be curious of the results of these monitoring efforts. So the mission of W-Sphere is to advance surveillance of sewage to inform local and global efforts for monitoring and supporting public health measures to combat disease. The data center plans on integrating data from dashboards to visualize on a map, which will in turn advance science in more ways than it already has. At the core of all this work is the data that enters the database. So this data flow describes where the data originates from. With the help from the COVID-19 dashboard that Fernando presented on, news sources are identified there. The database then extracts data from these dashboards and fills in a template which has specific geodata corresponding to the area in which sampling is taking place. Datasets are all managed through this database and then visually represented on the W-Sphere website through maps and trends. And some examples of different data visualizations are spatial data points, percent positives, or trend lines, etc. So currently the database has about 97 data points, 24 countries, 622 sampling sites, and over 15,000 samples, which these come from 13 different data sets. And as you can see, there's already a lot of data here, but there's plenty more that is expected to be added. So here's the main page. You can see that it's equipped with options to jump to the global map, to extract data, and to view case studies. It also has an up-to-date summary of the total number of countries, sites, and data sets here. And if we click on, so I'm going to do kind of a demo here through pictures. So if we click onto the global map you see on the top there, we see visualization of the dashboards that we have gathered. Standardized data points are represented as these green circles. The green points with yellow outer rings are dashboards that have not been standardized, and the gray circles are future data points that will be added. Within these circles, there are numbers, and these display the amount of sites within each data set. So if you hover over a country point, like this picture shows, a pop-up appears where you can then choose to view the website in which the data originates from. So you can either view all site points if you click onto there, and we'll use Scotland as an example. So when choosing the View Sites button, you see various red and green dots here. So these represent sites that are being tested. The size of the dot represents the population being tested, and the colors indicate whether there's presence or absence of the virus. So red indicates presence of the virus in the most recent sample. Green indicates an absence, and gray means that it's a non-detect. There's a timeline on the bottom right here where you can toggle, and once you do the top right samples box, will give more information about the samples in that specific time frame, such as the gene being tested and the population tested within those selected dates. There is also max and average concentration within the box. The bottom picture here shows an individual site that's being selected. So it's kind of like hovering over a site, and it gives more in-depth information about that site, such as the total samples that have been tested. So the samples box on the top right also has a trends view button, which displays some very interesting visualizations. So trends are represented within arrows and colors. So there's a red up arrow that indicates an increase in concentration detected, a white up arrow indicates a slight increase, a green down arrow is a decrease, and a horizontal line shows no change. On the right, you can see that there's an option to show a bar chart of the different concentrations in a chosen time frame. And overall, these different trends help the audience visually understand the trends that of virus detection in wastewater. So if you click data on the top of that main page I showed earlier, you'd get this page right here, and this is where you can access data used within the global map. You can see here that there's Arizona as well as Australia's data within the screenshot. So if you click on Australia, for an example, you see a description and overview of the amount of sites and samples shown, and there's also a time frame of the samples within the data, as well as the associated data files there. So while we're looking through all the global efforts to monitor sewage, we wanted to highlight examples that showed a lot of innovation in wastewater being utilized as a valuable resource. So these are in the form of the case studies here. Though wastewater monitoring is not a perfect way to get the number of infected individuals and is a rough estimation, it works well in tandem with clinical testing and has been constantly improved upon throughout the pandemic. So if you or anyone you know has data that can be submitted to WSphere, there's a contact form on www.waterpathogens.org, and please make sure to follow both of our the water pathogens Twitter and code poops19 Twitter for updates. I believe there was I think Dr. Naughton sent something in the chat for the Twitter in there. So we would like to acknowledge the work done by these individuals who have contributed immensely to this project. It's been amazing to work with everyone here. I have learned so much through this project alone, and just want to thank everyone for that. And yeah, we learned a lot of ways to improve through COVID-19. It has heavily promoted the need for people to come together to create solutions that better support individuals, communities, and environments. Through our research, we learned the importance of awareness of the inequities in communities, the same awareness that is needed to create meaningful change. We learned that it is important to get the youth involved early on and informed on issues that affect not only them, but all of society. Through this mindfulness, we can get students interested in equity, especially regarding the COVID-19 health crisis and problems humanity will have to face in the future. We need to not only appreciate the work that goes into caring for our basic necessities, but also support and advocate for our workers to make changes. Awareness of our communities' needs and flaws will help people become well-informed support systems. Also, we learned that data is a huge resource needed to make the public and health officials aware of problems a community is facing. Wastewater-based epidemiology has taught us the power of science and data collection and their role in fostering informed decisions and actions to keep communities safe. So through this convergence of ideas, solutions, mindfulness, and collaboration, we can work together to create a safer, healthier, and more equitable world for future generations. So we would also like to give a special thanks to these organizations for the support and resources to work on this research and presentation. We would also like to give a special thanks to CWEA for their work and always for supporting our efforts, as well as a special thanks to AAES for having us today. And that concludes our presentation. I will pass it on to Dr. Naughton now.
Yeah, thank you so much, Ariana, and thank you so much to all the student presenters and all their excellent work in preparation, and of course to AAES for their having us today, and all the universities and funding agencies. I'll transition here. My email is on the previous slide. If you need to contact me, the students, I can also put you in touch with the students if you have questions, or they can put their emails in the chat for you. Then Marissa, I don't know if you wanted to talk on this slide about
Yes, thank you so much, guys. That was great. Now we're going to open it up for questions. If you do have a question, just type it in on the left-hand side of your screen where it says attendee chat, and the team will answer it as they go along. And thank you for all those links. We'll have to put them together and have them available for anyone who wants a list. Okay.
Yeah, you're welcome. I know that's a lot. Yeah, so we'll get to questions. Maybe students, if you want to all turn on your videos. So we had a question, were there any studies made about virus load in streams, both upstream and downstream of a wastewater discharge from a plant? Fernando, did you want to talk about that?
Well, let me see. I know after, like, the infectivity of the virus really decays quickly, and so after the first preliminary and after the first preliminary and primary sections of wastewater treatment, the virus pretty much disappears since it's enveloped. But we do have access to a multiple variety of different sources. I could definitely send for the specifics. With your question, are you referring to infectious virus or just wastewater sampling at different locations throughout the wastewater treatment system?
Yeah, I think they were talking about virus load. They can clarify if they want. But yeah, there were studies looking at kind of upstream and downstream and showing like the wastewater treatment plants are removing the virus throughout the treatment train, and that we're effective treatment processes to inactivate the virus. What's being monitoring in the wastewater is usually is inactive, but it's the RNA or RNA fragments. There's some papers from, I think, Dr. Kyle Bibby's and Aaron Bivens' group, if you want to contact us with sort of some of those removal rates. But there's other groups as well.
And from what we've seen also is that people have been able to find infectious virus from feces and through urine, but no one has been able to extract infectious virus from wastewater so far.
Okay, Wendy, thanks for coming. And I think she has a question. So they're asking, what do you suggest we do to connect with these communities?
Oh wait, that's not.
Yeah. Thanks, Anna Grace. So to answer your question, I think the most important thing to do is to just reach out and physically go into the communities and make sure you're clear on like all the different people that your grand problem is affecting, and to go to those people, maybe have not like groups of people from those communities like tell you about their issue and how they can see us helping, and to just communicate on their level and really listen and understand to what's important to them, because it can shift your entire like solution. So yeah, that's my suggestion.
Anna Grace or others, do you have suggestions about connecting with communities?
I unmuted myself because I then saw the question with it had my name on it. So sorry. I think like connecting with communities, it's really all about creating those relationships and having a lot of open conversations and finding ways to network. I know networking seems as though it's almost like a transaction where both of us can benefit, and I think that's a really positive way of thinking about it with connecting with communities, whether it is like with the youth, like how can we both move forward in a positive direction and not solely think of how only one party can benefit from interactions, but really just like having communication or conversations really, I think, is a great way to connect with communities, like what Brooklyn talked about with youth. I don't know the last time I had a conversation with someone, with the high schooler.
I would like to also add a little bit, kind of with what Anna Grace said. I think that definitely connecting to the community is all about listening. And I thought of the youth webinar as well because I attended and I was part of just like the students there. And the moderators did a really good job of like listening to us and like what we had to say. And they really didn't intervene at all. And they just kind of wanted to hear like our thoughts. And really, it felt like we were connected in making a solution. So I think listening is the biggest thing, and not going into something thinking that you're going to go and like fix people or fix a community. You're there to help them and support. So that's my take on it.
Yeah, and I think Brooklyn mentioned using social media more, those platforms to reach out as well as going directly there. But some of these underserved communities may not have as good of internet or phone connections, so you do need to make those direct connections. And then Fernando, I think you mentioned multiple languages also in connecting with communities.
Yeah, so in order to be inclusive, it's really important to try to the best of your ability, connect. Even though there are language barriers, Dr. Na and I have used all the resources we can to try to connect with people all around the world. Dr. Na speaks French, I speak Spanish, but we've been able to, roughly through using translations, just scour the internet. And I've used every single form of Google, like Google Spanish, Google French. I've asked some of my friends who speak Japanese if they could search for wastewater words in the Japanese language, and it's just very important to try to be inclusive. Since one great thing I've learned throughout all of this is that there's really brilliant people and people that want to help, and also people in need all around the world. So, it's important to not let a language barrier stop that. And I guess I can transition over to the next question I see regarding contact tracing, and if it's possible, if we can use wastewater to, I guess, contact trace. And I think one of the important things in the field of wastewater that's happening right now is how anonymous it should be. Since it is, what I really like about it is that it's a pooled sample, so we don't have to make a certain person feel completely, I guess, scared to have their wastewater tested, since it's just a whole community as a whole. But I guess on a larger scale, for contact tracing, if we see it in a specific area, while not necessarily targeting specific people, we can still try to help by sending aid that way and sending more testing that way. But it is one of the new gray areas in wastewater, kind of how anonymous it should be. And so that's still being developed. And also, I saw the comment about the Scottish dashboard, and I would have a lot of pride for that Scottish dashboard. It's an amazing dashboard, and I really enjoy it. I also see another question by Wendy Wirt. Also, thank you for joining. I really love the CWEA. But there is a lot more data becoming available, which we really like to see. We really love to see data. One thing I would suggest to make it meaningful and useful is ideally making it standardized, or the way we report things somewhat standardized. From the different international dashboards I've seen different units for multiple things. I've seen some dashboards have very specific site locations and GPS coordinates. I've seen some have somewhat confusing units. Also, a lot of dashboards don't show their sampling methods, or if they're testing N1, N2, E-gene. So it's really nice to show all the lab methods, everyone involved, maybe contact information, pretty much all the data available. I love to see.
Yeah, thank you, Fernando. And also with contact tracing, they are going up in the sewer shed, so they have been able to kind of, if they get a signal at the treatment plant, and then if they're monitoring in the sewer shed, kind of try to isolate where that's coming from. But as Fernando mentioned, you have to pay attention to the, equity aspect or privacy aspect once you get further into smaller communities. But it can be used to help in contact tracing, but maybe not like specific individuals as much, though universities that have knowledge of their sewer systems, like Arizona was able to say that there's like 2 students probably infected in a dorm because they'd been doing wastewater monitoring for a long time. And Australia has really used it to kind of isolate certain areas because they used to have COVID 0 days. And so when they get a positive signal, they knew like, oh, we really need to have asymptomatic testing and everything. And even in Hong Kong, they used it for high-rise buildings and then like triggered clinical testing. Sorry, I won't go on too much about wastewater. I think Anna Grace, you had a question from Wendy.
Yeah, to find connections or increase the connections, when I said, which are Tom Vilsack's word, but not a lack of food, but a lack of connections. At the beginning of the pandemic, and we were seeing like a lot of these contracts being terminated. So if you think about like restaurants closing and that restaurants might get like a 50-pound box of potatoes, how can you then shift all of your processing facilities to then find a way to more individually sell those? It's really difficult, and it's not really quite profitable, considering that then you would have to shift back potentially after the pandemic. And so thinking of maybe more how we can play a role, because it's difficult for me to then look at the contracts for like cruise ships, right? How can I affect the food that's going to cruise ships and make sure that it's not a lack of food, but a lack of connections? If we think of more circular economics and more local food, it's a way to shorten that distance and have more connections. It is super convenient to go to the grocery store and just buy everything in one place, but I also have a strawberry farm stand like right around the corner, and the strawberries are really nice when they're closer to the source. So I'd suggest hopefully finding ways to support a more circular or local economy, or framework in general, not only economics, but finding ways to be closer to your food, and make sure that, I guess, sometimes you can read on the little label where it's from. So hopefully you can find more products that are closer to where you are, in hopes of making closer connections.
Yeah, great answer, Anna Grace. And also, I think restaurants stepped up and started like packaging, like they usually get big vats of milk or flour and like even the potatoes, and they were, even though they couldn't have in-person dining, they started becoming kind of mini grocery stores to do this packaging and sell it. So there were some like innovations we learned during the pandemic that we hopefully can document and not forget. I think Dr. Trotz asked a question in the chat about as we begin another semester in a few weeks, are concerns around COVID-19 different for you this year? And if so, what are they? So maybe Brooklyn can start, and then Ariana, Fernando, Anna Grace, if you want to add anything.
Sure. I think this is something that we actually talked a lot about in the education breakout room of the Youth Moving Forward session. One of the main concerns is how are things going to look when we go back to in-person learning. And a lot of the attendees in that breakout room were other college students. And so from that perspective, I think a lot of colleges are requiring the vaccine for their students. And so maybe in the middle of last year, if we were thinking about going back, there would have been a lot of measures put into place for protection, and maybe smaller class sizes and requiring masks. And now with the Delta variant, it's circling back around towards that. So I would expect some students to still be, cautious, and there to be different rules and stuff. However, most people are going to be vaccinated. Another thing that we talked about was just through the pandemic, a lot of professors have been accommodating and really flexible with their students. And I think that has like created a good space for students to connect with their professors, because when you understand that everybody's going through this pandemic right now and it's been difficult for everybody, it can lift that stress or anxiety off of students to know that if they need an extra day on an assignment, they can reach out to the professor and just ask. Or I know Dr. Maston, who was talking about this as well, she mentioned that she asks her students at the beginning of every class how they're feeling, if there's anything that she can do differently that will help them learn better. And I am hoping that when we return back in person, that a lot of professors will find a way to do these same things in the classroom. It's harder to like do polls or anonymous like surveys like we can do through Zoom or Microsoft Teams or whatever platform people are using. But transitioning into in-person, I think it's important to still incorporate that.
Yeah, so I can go next. So I will say a lot of things that Brooklyn mentioned, I also agree with. I think that we're obviously in a unique position, so there is still some stress and anxiety about the semester coming up. We've never been in a transition period between a pandemic and everyone being vaccinated and how to feel about it. I will say it is still a little bit stressful just going in and being around a bunch of people again, but there are measures that schools have been taking, so such as the wastewater testing at University of Arizona. That's also one way to help like relieve the stress of they're monitoring it over there. Mask wearing still is implemented in a lot of different places. So I don't know. I still think that there is a stress, but I also have hope that again with the Delta variant, if we did have to go online again, there is infrastructure there now. Now teachers know how to work online, so I think that is also really nice. So if we did have to make that transition, it wouldn't be the stress all over again how it was in the beginning of the pandemic. So that's kind of my take on it. I'm having hopeful outlooks, so try not to be too stressed about it.
I guess adding to what Ariana said, I'm also okay with transitioning online. I love being at home. It's like a really great time for me. But one thing that I guess makes me optimistic is that we're just learning so much more. We just learned so much about the virus and safety measures. And I'm really lucky for attending Virginia Tech because I have Dr. Lindsay Marr, Dr. Mark Edwards, and Dr. Emmy Pruden in the same building that I work at. So I know like the ventilation is going to be amazing. The wastewater is going to be tested. And I also think that that my colleagues, especially in grad school, will be hopefully very respectful and cognizant of levels of SARS-CoV-2. So I guess just all that we've learned throughout the initial large outbreaks, I'm hopeful that we'll do better.
I think everything that I would say is just like what everyone else had said. I think the big word is like comfortability, with how comfortable we all feel going back and how comfortable we feel with some of the changes and maybe not being or not agreeing with some of the changes that are being made. I think the pandemic has really showed us that sometimes we think or are a little bit selfish. And so I think being surrounded by a lot of people and being very trusting of others and not knowing them, I think is a positive. but also somewhat of a concern. We're very aware now that we all affect each other. We're all global citizens. Before we were a citizen of anything else, as we're all global citizens and we all affect each other. And so I'd say the main concern is, at least for me, is maybe like comfortability and trusting of others, and being very open to others, trying to make sure that I'm being appropriate as well. But I think it's all about, thinking together and all of us being a part of the solution, which has become very clear during the pandemic, that we all affect each other, but we can all additionally work together to be a part of the solution.
Yeah, thanks everyone for your excellent answers. Dr. Trotz did mention about, not all schools are requiring vaccines. I mean, the University of South Florida, and there's like some others throughout the country that are still haven't had the vaccine mandate, like the UC system, and yesterday the Cal State system announced it. So that is definitely a concern. I think, unfortunately, we've felt that the pandemic is over since the vaccines are available, but not getting to like the 85% or higher vaccination rate. And there's still some hesitancy and some disparities with that. So I think, unfortunately, we're not to like turn away this positive spin, but we need to still be vigilant through the fall. We may have a fall surge just with the seasonality of the virus. And I've seen that some universities are stopping wastewater monitoring and all these kind of like rigorous like protocols they had, and they need to pay attention to ventilation and face coverings. So I think there's going to be an adjustment when we go back in the fall, and hopefully we can. I know everyone's tired of the pandemic, but the pandemic is not tired of us. So we need to keep pushing, even though we're all pretty exhausted from this pandemic, but there is light at the end of the tunnel. So I think Anna or Ariana, there's a question from Paul about your Navajo project.
Give me 1 second. What was the question? Sorry, I don't see it.
Will your work with Navajo Project continue your work here?
Oh, I see it now. So no, it'll be a different project. I think over there we'll be working more on off-grid water supplies. I mean, I think no matter what, it'll always come back to a lot of the learning that I had here with COVID-19. So definitely working with the Navajo Nation, they were hit pretty hard with COVID-19. And so having to kind of learn about like why that happens and how to best support them, I think will kind of connect with this project here. I will unfortunately not be working on wastewater, but still water. I love water. So I'm excited about that. Yeah, thank you for the question.
Okay, thank you so much. That was a great discussion. And thank you everyone for all your questions. We're going to wrap up for today, but if anyone has any additional questions, you can email them, or you can email me if you need to grab an email address. Our next webinar is scheduled for August 25th, where 2 leaders from Black and Beach will be discussing the application of S2EBPR to enhance phosphorus removal and recovery. The page to register for this webinar, for the next webinar, will open as soon as this session ends, and it will also be on our website. That wraps up our event for today, and thank you so much to everyone. Have a great day.
Thank you.
Bye-bye.
Bye.